Hi, today I'm going to give you an update on Swedish model against COVID-19. And before this one, I already made two videos which discuss the Swedish model against COVID-19. If you are interested on this Swedish model and also see time progress of the model, you can go back to my video channel and just search for this Swedish model against COVID-19. And let's have a look what is a Swedish model in case you not know. And the Swedish model is against COVID-19 is basically life is more or less normal. And there's no lockdown, and there's no closed board, and no shutdown schools, workplace, restaurant, library, gym, and shopping center. And so basically they have kept social functioning and have normal activity. Of course, the government does emphasize practice self-quarantining and have social distance and have relative limitations on this individual activity. And so the Swedish model is very interesting because they can teach us a lot more about how this virus behaves, and so we can learn something from it and then give some guidance how to make relative procedures to protect us against this virus. Again, let's have a look at data. How is the model doing? And this is data from October 10th, 2020. So just look at this COVID-19 cases and deaths in Nordic country. And because these four countries, Sweden, Denmark, Norway, and Finland, should have relatively close geographic and population statistics, and you can see that the total cases, Sweden is close to 100,000, and other countries have less cases, and also total deaths, Sweden is close to 6,000, far exceeding other Nordic countries. And so, however, these two total cases, total deaths is not accurate. So, in order to have combination, and this two numbers normalized by use 1 million population. And so there's 1 million population total cases and 1 million population total death. So the normalized total cases, Sweden is close to 10,000, and this is 2 times of Denmark, and about 4 times of Norway, and 5 times to Finland. And when you look at total death, and the cases is even worse. So Sweden have close to 600 total deaths in 1 million population. This is 5 times Denmark, 10 times Norway, and 9 times Finland. And from this number, and that indicate that the Swedish model is really not working, because the total cases and total deaths in terms of this infectious disease, that is what we are looking for. Of course, there are many other factors, and because they don't lock down the country, and so Sweden basically have normal economic activity. So I think they have some gains on economic in terms of this people's life and people's freedom. There's no any restructurings. That's they lost something, but they gain something. And it is hard to see the overall situation. And also, when we can also look at this cases of death and between the different time points. So I start to record this on April, and then made another video in July, and now is this October. So we can have the data to compare, and of course compare this peak season and also July. They have significant increase in terms of total case and total death. And so when this data compared to October, and total cases have some increase, about 20%, but our total death is kind of stabilized. And even in Denmark, the total case have been almost double, have double total case, but the total death is kind of not increased so much. And in Norway, the total case is at least increased about 8%, but total death has no significant increase. Same is hold true for Finland. The total cases increased significantly, but total death is no significant increase. And this is just look at one data point, so maybe giving more information when you look at this data in this dynamic process. And in this table, just look at total cases. The x-axis look at timeline, and y-axis look at this daily cases. You can see it in the June, the cases have a huge increase. And the second wave in Sweden, they have some increase, but it's not as high as in June, July. However, in the Denmark and Finland, in this wave, and the case was surpassed this during April peak, and maybe this indicate at least some indication that maybe that this Swedish model, because the law allowed people to have free, so that's in the population, they already established some kind of immunity against the virus. So in the second wave, they have not as high as in Denmark and Finland, even Norway. That cases is not as high as other countries. And what is more interesting is that when we look at the death, even so right now the cases increase, but the total death is no significant increase. Of course, in the Denmark they will have slight increase, and also in Norway the slight increase. But overall, the total death is no significant increase, because as we can see that in Denmark and in Finland, in the second wave, the total cases surpassed the case in April, but the total deaths is only have almost the baseline. And same is held true for Sweden. So that indicates waves without lockdown. And the new cases is both cases increase, but the deaths is not have significantly increased. And this is really exciting news, and good news. And that means that in the population, the COVID-19 infection, immune cells increase, but death, this is one of the most important parameters to evaluate this such kind of infectious disease, is kind of stable, or basically it looks like the common cold or flu. So that is really good news. So because if we can control the death, and so this kind of infection, just like normal immunization or vaccination, and we are going to look at data at least in the flu season, and it will be very exciting to see that, and we can control the deaths to the baseline. And in this case, then we basically have controlled this virus infection if we can control the death. And this is really, really exciting news, and hope we can have control and to prevent death from this COVID-19 infection. That's the video for today, and I wish everyone have a healthy and happy life, and see you in my next video. Bye.